have no alternatives for their future. My concern is for those individuals with a severe or profound condition who have reached the age of 22 and are still on the waiver wait list. Special education vouchers such as the McKay program or cooperative agreements have provided some options and alternatives, but they also expire at age 22. The profound disabled are not able to get a job at Goodwill or go to college. They require a safe and structured environment. Without assistance, their future will be to vegetate at home. Ultimately, their parents or guardians will be forced to become 24/7 care providers. In time, especially with the aging of the care providers, the family structure will collapse, and these children will be placed in a group home years before it would have been necessary. The burden now will be placed on the state for their full care. Presently, there are about 8,300 individuals who are over the age of 22 on the wait list. Even if only 5%, that's only 5% of 415 individuals fall into this situation, the annual burden to the state would be almost $10 million annually. Yet there are steps that could at least delay, possibly for years, the need for these special needs individuals to be placed in group homes. We do not need a new bill for additional funding. What is needed is a better way to allocate and distribute educational funds for the severe, profound special needs individual between the ages of 18 to 21. The $20,000 to $24,000 per year for severe, profound education would total $80,000 to $96,000 per individual in a district school between the ages of 18 and 21. If those same funds could be distributed over a longer period of time in a less expensive facility, then the family structure would stay intact longer. For example, the tuition to attend an adult day training program at ARC for the same amount of hours and days in a district school would cost approximately $7,000 per year. Rather than 1 year at a district school, the child could get as much as 3.5 years at another educational facility. Instead of 4 years at $96,000, the child could receive as much as 14 years at another educational facility, extending educational opportunities to age 31. In summary, my request is to allocate educational funding for the severe, profound special needs children between the ages of 18 to 21 so that they can extend their educational opportunities. I'm asking for legislative reform to improve allocation of educational funding that would not cost the state an additional penny more. It may very well keep a special needs child from vegetating and keep a family intact. Thank you.
Thank you, Tony. Any questions? Good. You've done a great job, and we also have to give some kudos to the school district because of your work with the school district. They're now actually working on a plan, my understanding is, in transitioning the children out, which before there was no transitional plan.
True.
So, which has been very helpful, but this is something I think that we do need to take a look at.
We need to transition someplace.
Someplace, exactly. Great. Thank you, Tony. Okay, next, we have about 15 minutes left. We're going to finish through everybody. So we have Early Learning Coalition, and Jackie is here to present. Thank you.
Hi, I'm Pat Houston, Director of Programs for the Early Learning Coalition. Jackie stepped out.
Oh, okay.
Yeah.
I didn't think you looked like Jackie.
I've changed a lot. Thank you for the opportunity to present today. Thank you for your interest in early learning. We were thrilled when we had Representative Mayfield at one of our child care providers in the last month reading a story to a VPK classroom. It's wonderful. So we thank you for that. We wanted to give you an update today on the status of the coalition in Indian River County. Presently, we have just about 650 children enrolled in the school readiness program. That's birth to 5. They tend to be the low income, the working poor groups. There's an income eligibility associated with it. And we're in the process now of working off of a wait list. We had about 200 recently on the wait list, and we've been doubling staff up in the office on certain days to try to reduce the wait list as much as we possibly can. So there's a significant effort in that regard, and we hope to be able to announce an open enrollment period before too long. That's difficult for us because the legislative session that ended, there was the new Bill 7165, where we can now serve the victims of domestic violence and the homeless population, which are critical areas for us to serve. We're getting the word out to them now, so we may be seeing increases just from those mandated populations as well. In that light, we're asking for consideration with regard to funding because we're expanding who we're serving. We're trying again to serve as many as humanly possible in this critical age group. Indian River County is special, although it's representative of our other counties as well, but they have tremendous momentum for the moonshot moment. And the one thing that became clear in all of the work groups that I've been in associated with that effort is the critical nature of early education. Kindergarten, it's too late. You catch these families early at the exposure to experiences and languages where their synapses are still firing at a high rate. You can make such tremendous impact in the early years that you can't catch up again later. Right now, we've just finished the pre-assessments for the school readiness program. Every child is assessed in the critical areas of growth, and then we review the weak areas with the child care director so that specific targeted areas can be done to improve the performance to try to get them on level before they enter the school system in kindergarten. So again, we're asking for consideration with regard to funding, but not at the sacrifice of quality. We do provide training and technical assistance for child care providers as well as the oversight of the programs. So thank you for your obvious interest in early education and the investment that it provides for our communities.
Great, thank you. Any questions? You good? Okay.
Thank you.
Okay, thanks. Next, we will have Tobacco-Free Partnership of Indian River County and Student Work. No students today?
No, I'm so sorry, but as you can tell from it's almost time to leave, the students probably would have been sitting here for almost 3 hours. As it is, I'm Leslie Spurlock. I'm the Tobacco Prevention Specialist for Indian River County. I work for QuickDoc Research and Education Foundation. I was not intending to speak this morning because I had two of our partnership members who volunteered to come in and talk with you. However, Don McGee, who was here earlier, had to leave. He is the director of pulmonary services at Indian River Medical Center and had a surgery at noontime. So the other person, Doris Butler, who represents United Way on our partnership, is taking care of her elderly father and unfortunately got a VA appointment for him this morning, so she wasn't able to be here. So I do have comments from both of them to read to you this morning. This is from Doris Butler. I apologize for not being able to be present, but thank you for the opportunity to be heard this morning. Excuse me. The Tobacco-Free Partnership has made great strides in this community to make Indian River County not only a better place to live, but also a healthier place for our children to grow up in. To do that, we have worked to put in place policies to address these issues. For example, policies concerning the sale and use of electronic cigarettes. And we have helped several businesses and workplaces become smoke-free. We work hand in hand with members of our SWAT, Students Working Against Tobacco, group to devise ways and activities that will reach and are relevant to our kids in school. We are actively working on increasing the number of youth who do not use tobacco. Without the support of the Florida legislature, we would be unable to continue this good work, and we sincerely thank you for actively supporting tobacco prevention in Indian River County. Respectfully, Doris Butler, representing United Way of Indian River County. The next is from Mr. Don McGee, as I said, the Director of Pulmonary Services at Indian River Medical Center. I would like to thank our legislators for taking a proactive, healthy step in supporting community-based prevention programs. I'm a member of Quit Doc's Tobacco-Free Partnership. With the partnership's assistance, on November 21st, 2013, the Great American Smokeout Day, Indian River Medical Center implemented a tobacco-free policy at all of our facilities. Our medical facilities see over 200,000 patients a year, and we are committed to improving our community's overall health and wellness. By eliminating involuntary smoke exposure, we will ensure that we are creating a healthy environment for all people who visit Indian River's facilities. As a healthcare institution, IRMC sees firsthand the devastating effects of tobacco, from cancer and heart disease to asthma and emphysema. Smoking and the use of tobacco products slows the healing of wounds, increases infection rates after surgery, and often causes poor birth outcomes. We realize that overcoming a dependence on tobacco can be challenging, and with that in mind, we will be assisting all employees, patients, and others in the community who wish to stop smoking. IRMC is offering a series of cessation programs and a support system to help make this transition to a healthier lifestyle a success. Allowing a harmful substance like tobacco use directly contradicts the purpose of our mission. We certainly appreciate your support of our initiative by supporting community-based tobacco prevention. Thank you.
Great. Thank you, Leslie. You guys do a great job, and the children that you work with, I think, have made an impact on their peers, which helps out a lot.
I'd personally like to thank the cities of Vero Beach and especially the city of Sebastian for all the work they've done on regulating electronic cigarettes, as well as the county, who has also passed an ordinance regulating the placement and age restrictions on electronic cigarettes.
Great. Thank you very much. Next, we're going to have Dr. Barry Hummel, who is actually going to speak about those electric cigarettes, which we had an opportunity to spend quite a time together and
Thanks for acknowledging
educated
that.
me.
I, just so you know, I'm a pediatrician by training, and my organization works on youth tobacco prevention issues. But I'm looking at some issues today that are more at the state level, things that the local communities can't actually address or that would support the good work that they're doing. The first issue is one that I've been bringing before the legislature for several years. We actively support a closure of a loophole in the cigarette user fee that allows tobacco manufacturers to simply relabel their products to avoid the current fee. In 2009, the legislature increased the cigarette user fee to $1.34 a pack. However, Florida remains the only state with no user fee on cigars. As a result, the tobacco industry has relabeled certain cigarettes, instead calling them filtered cigars, to bypass the user fee. These cheap, flavored products target Florida youth, ranging in price from 99 cents to $1.59 per pack, when compared to $5.79 for traditional cigarettes. The impact of this is revealed in the 2012 Florida Youth Tobacco Survey, where both middle and high school use of cigars exceeded the use of cigarettes for the first time ever. We support closing this loophole so that the user fee for those products is the same as it is for cigarettes. We are also in favor of addressing the broader issue of the cigar user fees in Florida to try to stop this alarming trend from continuing. Next, we continue to actively support the removal of the preemption clause in the Florida Clean Indoor Air Act, which would allow counties and municipalities to regulate outdoor smoking based on local community standards. This clause, which can be found in Florida Statute 386.209, prohibits restrictions on smoking in parks and playgrounds, making it impossible for communities to completely protect their children from the effects of public smoking. This session, Senate Bill 342 and House Bill 309 have been introduced. Those bills are designed to allow communities to restrict smoking, but just in playgrounds. Very specific, tight definition. While we support these bills, we do not believe they go far enough. What we would like to see is that the preemption clause is removed and that you actually list the exceptions in the body of the bill. And finally, and probably most pressing this year, we would like to bring a new issue to your attention. The use of electronic cigarettes among youth, both nationally and in Florida, has dramatically increased. In 2013, 5.4% of Florida high school students reported current use of electronic cigarettes. That's nearly two-thirds the number that reported using regular cigarettes. It's the only form of tobacco that is increasing in use among youth in the state of Florida. While the FDA has been granted the authority to regulate these products as tobacco products, no rules, including age restrictions, have been passed at the federal level. 23 states have passed laws restricting sales to adults ages 18 and older. Other states are also including electronic cigarettes into existing clean indoor air legislation. We actively support legislation to put these same rules in effect for Florida. Senate Bill 224 and House Bills 153 and 169 have been introduced for this session. And while these bills would restrict the sale of electronic nicotine delivery devices to adults, the language appears to create a separate category for these devices. This may exempt them from other rules regarding the sale and marketing of tobacco products. We urge caution as you review the language of those bills in committee. Make sure it's an age restriction and not a carve-out to bypass taxation on that form of nicotine, clean indoor air legislation, and other rules regarding tobacco. I provided additional information on each of those issues in your packet. Thanks again for your time, for all that you do for the children in Florida, and I'm happy to answer any questions.
Great, thank you. Any questions? As you and I spoke earlier, if you could help me with that amendments that we were referring to.
I've looked at it very carefully. In the same statute, they define tobacco, and I think if you simply added electronic nicotine or some other language to say this is tobacco, you don't need the carve-out of the additional language. I think that would solve the problem because it would be classified as tobacco like at the federal level, and It would meet the criteria, and all the rules would still apply.
Okay. If you could just get with our staff, and we can work on making that happen.
Thank you very much.
Okay. Thank you. Okay. Next, we're going to hear from Indian River County Healthy Start Coalition.
Good morning. Thank you for the delegation's time and interest. I truly admire your dedication to public service and your endurance. My name is Dr. Glenn Tremmel. As emergency physician of 23 years, I am currently the board president of the Indian River County Healthy Start Coalition, and I'm here regarding 3 funding things which will come across in the next budget. Although I consider myself a pragmatist and fiscally conservative myself and politically, I am asking for an increase in the Healthy Start budget of $2.5 million statewide. This is in response to the Medicare reform requirements, which we are required to do, which makes sense, but we will need additional funding to perform those requirements. The second thing is to restore $5 million to the Healthy Families Program, which was in the budget until recently and has been removed. The reason these services are so critical, one is for your own constituents in particular, is that Indian River County, unfortunately, out of the 67 counties, is 7th or 8th in the 3-year rolling infant mortality rate, and it's 3rd in the state in terms of the black community. In addition to this, you all have, I think all members of the delegation who are scheduled to come here today have 3 of your own children. So you know the importance of the early formative periods which need to be supported. I have no interest in supporting programs that have no proven benefit, and as a physician and former researcher, I was convinced that the Healthy Starts programs were justified by reading multiple studies from the University of Florida, Harvard School of Public Health, and other institutions. They demonstrate that Healthy Start programs do indeed have positive effects and reduce both immediate and long-term costs to the community. A full-term baby receives about $5,000 in health care through their first year of life, where a premature baby is $49,000. In regards to the Healthy Family programs, I personally followed a new mother, a 17-year-old high school student with ambitions to become a nurse, and followed her from her first home visit when she brought the baby home until her baby's first birthday. I understand that she and her baby are doing well. She's stayed in school. She's taking good care of her child. But imagine the cost to the state and the community, both emotionally and financially, if she did not have that support at the critical time of bringing her baby home as a 17-year-old. Senator Negron was proud that he was one of the champions of restoring funding to the Healthy Start and clearly understands its values. I am hoping that you believe that I do, that Healthy Start and Healthy Families continues to be a wise investment. And to be frank, if it is necessary to cut funding in other areas which do not have proven success and do not have the impact of our most vulnerable members of our community, consider cutting those and continue funding to Healthy Start. I have one more request that you consider when asked for funding for fetal and infant mortality reviews. The Healthy Start Coalition wants to utilize our budget, 1/4 of which we have to raise ourselves, to get state funding and federal funding in the most effective way possible. Without funding for fetal infant mortality reviews, we do not know what areas or what conditions affect infant mortality locally. We want to target our programs to those areas, and we cannot without the current information. So thank you.
Thank you. Now, understand, are you doing the presentation for the Healthy Start families?
I kind of
combined them all
two.
together.
Save
Okay,
some
that's what I
time.
was thinking. Okay, that was great. Thank you. Okay, next we have Cultural Council of Indian River County, Barbara Hoffman. And then we're down to Susan Mill with Common Core after that.
Madam Chairman, Senator Altman, thank you so much for this opportunity to appear before you today. I'm Barbara Hoffman, Chairman of the Board of the Cultural Council of Indian River County, the county's local arts agency, a membership organization representing 250 arts and cultural organizations, businesses, and patrons. The 2014 Florida Legislative Platform for Arts and Culture preserves and creates jobs, generates local and state government revenues, and expands and promotes cultural tourism. We are asking to have you restore Florida's investment to at least $16 million for the Florida Department of State Division of Cultural Affairs grant program for cultural and museum grants, Culture Builds Florida specific cultural projects, and the state touring program. The Vero Beach Museum of Art and Riverside Theater serve as a part of the economic development of Indian River County, as well as are the tourist attractions. Both are applicants for cultural and museum grants for general program support. The museum has also submitted a matching grant request for cultural endowment. The general support grant applied for by the museum is for general support. It is used to cover personnel costs for program implementation, as well as outside fees and services for programs. The museum is the principal visual arts facility on Florida's Treasure Coast and serves a 3-county area and more than 75,000 residents and visitors annually. The general support grant applied for by Riverside Theater focuses on 4 key areas of strengthening the economy, learning and wellness, design and development, leadership, arts, and cultural heritage. Riverside Theater is a leading arts institution attracting the very best creative and talented artists in the business. Last year, it increased its attendance 18% to 90,000, with 48 states represented in their audiences. Approximately 51% of Florida's arts and cultural not-for-profit organizations' annual operating budgets must be raised through individual contributions, fundraising events, corporate and foundation support, and local state and federal government grants. State support is critical to help leverage other revenue sources critical to sustaining this creative industry: jobs, programming, arts, education, and greater access for more residents. Florida's investment in the arts and cultural resources is now 73% less than it was 6 years ago. In fiscal year 2007, Florida invested $34.4 million in statewide arts, arts education, and cultural grants. It now invests $9.2 million. Working together through public and private partnerships, let's rebuild and restore Florida's investment in this critically important creative industry that is vital to the state's economy, education, success, tourism, community development, and quality of life for residents of and visitors to Florida. Thank you very much for this opportunity to speak.
Thank you, Barbara. Okay, next, our last speaker is Susan Mill, and she's going to speak about the Common Core.
Hi, good. I was going to say good morning, but that's too late now.
We're already past.
Thank you for letting me speak to you today. I'm not going to take time to enumerate the many reasons that we've researched and developed over the past short year for why Common Core is not good for the children of Florida, or any state for that matter. You can easily find all the reasons in the myriad of letters I'm sure you've received from us, as well as an internet search that will bring up many, many websites. What I'd like to talk about are concepts and principles. And let me state from the start that I am not against standardized tests in any way. And I think a combination of tests and other analysis methods are important when we want to analyze the capabilities of our students and our schools. But my problem is with the rationale for why we need federal standards, the curriculum required to teach them, the developers of the curriculum, and the massive data collection that was so skillfully attached to them. I remember when FCAT was implemented by Governor Bush, and the many parents and teachers who were concerned that it wasn't a good thing to have to teach to a test. But I think that is one way of finding out how kids are learning. I thought the FCAT testing improved schools in the state, but FCAT was a state-created and mandated effort. Why? I don't know why Jeb Bush is now throwing FCAT under the bus when we paid for its creation and its implementation. Why couldn't it be improved? Maybe we should follow the money, but we won't go there. At a conference this summer, the future of education, as Common Core developers see it, was described to include every child with the laptop reading, working, and testing on it. And if student-specific data shows that Johnny likes baseball rather than football, his math problems could be programmed to involve numbers related to baseball and not to football. Gasps were heard throughout the room. But I say let's embrace technology if it is proven that it helps with education. I also say that let's let those laptops go home so parents can see what their kids are learning, working on, their test scores, and their quizzes. But actually, taking those laptops home is not in the plan of the people that develop Common Core. Most important, as we've heard throughout the morning, is the cost. Let's look at the cost of all of this laptops, all of the software creation, and all of the data collection costs. We also ask that if this was the latest, greatest total redo of the U.S. education system, which is what it seems to be and is what Arnie Duncan says it is, why wasn't it shouted from the rooftops? Why did groups fighting Common Core have to alert parents here locally throughout the state and states all over the country about what it was all about? Why did the school boards here in Indian River County and throughout the state have to bring in state officials to answer parents' questions? And where was the proof that it really works? We also ask, what's the rush? At a time when our counties and our state are trying to cap overhead, why does Indian River County, for instance, have to spend an extra $125,000 on IT staff? Unexpected and unanticipated, and they suggest that the federal money that's coming for IT through Race to the Top and other grants will only help with the startup of the data collection, and that they will have to seek more and more funds to continue it throughout the years. And why are we having to order all new textbooks which haven't been reviewed by the local school boards? But let's forget about the money for a minute and boil it down to two very basic principles: parents' rights and the 10th Amendment. One of the cornerstones of our republic, like private property rights, is that parents have the right to control their children's lives. Parents have the right to determine where, what, and how their children will be taught. And not to be over melodramatic, but you are, in Tallahassee, our first line of defense against the tyranny of a federal government set to take over control. You are the keepers of the 10th Amendment flame. That everything not enumerated in the Constitution and the Bill of Rights as the power of the Fed is delegated to the states and the people. So we ask you to support Representative Mayfield's bill, sponsor it in the Senate, if you will, that will stop Common Core from being implemented and will ensure that standardized testing in the state is what reflects the values and the principles near and dear to the hearts of parents in this state, and that you stop the costly, massive, student-specific data collection. Thank you.
Thank you, Barbara. Or Susan. I'm sorry, Susan. That ends our presentations that we have. We have a few people that want to make some comments. And Lamar, if you come on up, since your discussion is going to be on education. And then after that, we will have Larry Close and Bob McPardon, and then Phyllis Fry. If you guys will get on deck so we can get through, that would be great.
I want to thank you, Representative Mayfield and Senator Altman, for giving us the opportunity to have our voices be heard, because frankly that's not happening here in Indian River County. Our school board has not been receptive to our concerns, even though we have given them very specific and general information about Common Core and its negative effects both on teachers and on students and on parents' rights. They're not listening to us. So I thank you for the opportunity to make our voices heard. And secondly, I want to thank you, Representative Mayfield, for having the courage, the extraordinary courage, to do the right thing despite knowing that it wasn't going to be popular with your own party, to take this on and to establish HB 25. I ask you, Senator Altman, to encourage your fellow senators to develop a companion bill to stop the park testing and to implement, to strengthen states' rights, the 10th Amendment, and to strengthen parental rights. And I just wanted to show you, they keep asking us for specific examples in curriculum. First of all, I don't think it should be the burden of proof should not be on parents. It should be on the creators of the curriculum to prove to us that their curriculum really will do what it says it will, that it will increase student performance. We are spending about $10,000 per child per year on our public school children. I could send my child to a very nice private school with that $10,000. So I don't think the burden of proof should be on the parents. Most parents that I know don't have the time to go through every page of every book to make sure that everything that their children are being taught is in compliance with their wishes and their values. But I wanted to show you a specific example that my daughter brought home from Vero Beach High School last year. What I see in Lincoln's eyes, this is basically mastering the FCAT. It is an assignment that is written by Barack Obama. I can only imagine what parents and teachers and the media would have just gone ballistic if President Bush had tried something during his tenure like this. But it's basically an autobiography by Barack Obama with companion questions, 8 questions, okay, multiple choice questions. Here's another one. Here's another assignment was given to students, saying that Social Security taxes are taken out of your paycheck. The money you pay to Social Security is redistributed to senior citizens so they can maintain a decent standard of living. And it says right here, the Social Security program was created in 1935 during the Great Depression. At that time, many elderly people lost their life savings and had no income. The program collects payroll taxes from current workers and then redistributes that money to current recipients. Those who receive Social Security include retired people, people unable to work because of a disability, and in some cases, the widowed spouses or orphaned children of such individuals. Is that really what Social Security is about? Yet this is what our children are being taught. It's garbage, and it's politically correct, and it's coming straight from Washington, D.C., contrary to what we've been told repeatedly by our local school board, that this is a state-led initiative. So I just want to, I will end with that because I know it's late. I had a lot more, and there is so much more available for you legislators and for parents and for teachers to explore what we're saying about Common Core to see if it's true. We weren't given that opportunity because the whole program was developed with Bill Gates funding behind closed doors in Washington, D.C. So I want to encourage parents to go to whatiscommoncore.wordpress.org. Hogwash Alert is a great place to start. It's extremely well documented. There are 2 or 3 links in every single paragraph to document everything that's being said, to prove that what we are telling our school board and what we are telling you as our representatives, as our voice in Tallahassee, that what we are saying is true and that we have proof.
Thank you, Lamar. And also, just so everyone does know, Speaker Weatherford and President Gates has written a letter against the standardized testing that Common Core originally came out with, the park testing, and as well as Governor Scott has done the same thing. what we'd be waiting for is to see what happens at the end of December when those reports is required from DOE as to what their intent is from the standardized testing being on a state level. So I think we'll have more information on this by the end of December as to which direction the state may be going on this. But thank you very much, and I am glad to see that parents are getting engaged in this because it is a local issue. It is parents, children that are concerned, and we should be outraged because we didn't have a lot of input in what was going on. So thank you very much, and I appreciate you guys challenging your school boards as well because that's where it starts. So thanks. Larry.
Hi. I'm hungry, so I'll be short.
Me too.
I hope you are too. This Democracy in Action is just great, and it's late, and we're all tired. I've been here for 3 hours. My comments to you involve billions of dollars, probably the most anybody has spoken about today. We have an open government. We're very proud to live in Florida because of sunshine laws. We like to see what's happening, and almost always we do. There is a giant flaw in Florida law, and that's what I'm going to point out, I'd like you to fix. If you look at Indian River County, our county commission and our public works, they spend hundreds of millions of dollars on public works projects because the county commission requires it, not state law. All projects over $50,000 are done by sealed competitive bidding. It is the only way to do business to protect the taxpayer. It's the way that the law in Florida should require it to do, not just the county commission choose to. I'm aware of other states, because of my education and engineering background, where it's by law the state does require this. Not all states, but many do. Our county school board is the local exception. It also spends hundreds of millions of dollars on construction, never using competitive sealed bidding. And that is not the way to protect the taxpayer money. It's done in the back room, out of the public eye. We're not suggesting it was done illegally or immorally, but it's done away from the public eye, away from taxpayer protection. The county way is the right way, and I'd like you, both the Senate and the House, to introduce laws that would put that as a requirement rather than as an option. Thank you.
Great. Thank you. Thank you, Larry. We're going to hear from Bob again. Children and families in foster care. This is your other hat you wear. I know.
That's it. Good afternoon. Now is the morning. Now I'm in the afternoon. I'm waiting for the evening session. Okay,
the chamber's waiting for us over for lunch. So
all right. Well, that's fine. I'll be quick. Again, I'm the Community Development Administrator for the Department of Children and Families here in Circuit 19. And I know you're going to have a lot of great bills in front of you and determining what's best for the state of Florida. I'm here on behalf of the children and families. You know, I've been involved in child abuse for almost 13 years now as an investigator, and I've been promoted up through the ranks. And any funds that you have available for child abuse prevention funding, as well as last year, you extended the age of foster children up to 21, the legislator did, but they didn't appropriate any money to support that. So if there's any funding, looking into that. As well as, you know, there's several groups here, Early Learning Coalition, Healthy Families, and Healthy Start programs. I'm here to put my stamp of approval on those programs. What they do for families and children at risk, and ultimately the Healthy Families and Healthy Start programs, a lot of those families don't get involved in child abuse situations because they head it off. That's money, that's prevention. You know, you put the money in now, it will save us a lot of money down the road. And so that's very good. As well as I heard Sheriff, he started off the meeting. I'm in support of, you know, his initiatives as far as strengthening domestic violence laws. Domestic violence is very destructive to children that grow up in those homes. They don't get involved. Sometimes what happens, a tragic event, they gravitate to one parent or the other, whoever's involved in the fight, but they grow up in those homes, and what happens typically to the girls who grow up in those homes, they become victims of domestic violence as they get older. They say in their head they'll never get involved with somebody who talks down to them or abuses them, but something happens in their head and they gravitate towards that kind of individual. For the boys who grow up in that home, they typically grow up and they have a lower sense of what women stand for, and they typically become aggressors. So domestic violence is a very dangerous, destructive thing in our society, and anything we can do to strengthen those laws we need to do. And as well as he said about the marijuana laws, not allowing it to become legal, that is a gateway drug, but I mean, if you make it legal, the problems that marijuana causes in our families is just tremendous. So thank you.
Great. Thank you, Bob.
And, of course, my office is always available. You have my cell phone numbers. Anything I can help you with, any kind of department, children matters, adult matters, I'm always available.
Great, thank you. You do a great job for our children. Next, we're going to have Phyllis Fry, and then Walter Geiger, and then Frank Messing last. Hey, Phyllis, thank you.
Hi, how are you? It's nice to see you all again. I'd like to review an issue I presented at the Delegates Legislative Meeting on September 19th, 2013, and another meeting with Senator Negron on July 25th, who shares my concerns regarding the defunding of the Treasure Coast Regional Planning Council and the South Florida Regional Planning Council. In March of 2012, the Treasure Coast Regional Planning Council acknowledged misappropriation of grant funds totaling $700,000 of taxpayers' money with no deliverables by the SFRPC. This was confirmed by Executive Director of the Treasure Coast Regional Planning Council. Monies were being used for purposes other than for which it was designated, private use of public money, which is corruption. Further to this matter, perhaps now is the time to question the validity and the purpose of the Treasure Coast Regional Planning Council. Their main DRI purpose was legislated away by the state, so they are just the facilitators of whatever authority they can create, with whatever authority that wants to use them, representing only themselves. This is not representative government. They have joined the 750 group, a facilitator that will use combined HUD, DOT, and EPA grants, a massive intrusion of federal funds to merge 7 Florida counties into one mega region. At the recent joint Treasure Coast Regional Planning Council and 750 meeting, appointee Paul Wallace urged the group to work on legislation to create one MPO and one FDOT district for all 7 counties. This is not representative government. This is about bypassing our powers of local planning and zoning rights and home rule granted under Florida statutes. Further to the infractions of legal and ethical standards occurs an operational environment absent of Florida sunshine laws, with confidential declarations as a matter of practice. Due to corruption, a lack of representative government, the enforcement of regionalism, the bypassing of Florida statutes and home rule, and noncompliance with sunshine laws, that we respectfully request the defunding of the Treasure Coast Regional Planning Council and the South Florida Regional Planning Council. We further request the elimination of funds for key programs at HUD and DOT related to the further operation of the Southeast Florida Sustainable Communities HUD grant initiative known as 750, which has been voted down by Indian River County, the City of Vero Beach, the Indian River School Board, Indian River Shores, and St. Lucie County, but remains in Martin, Palm Beach, Broward, Miami-Dade, and Monroe counties. Thank you, and I'll race you to the luncheon. Thank you for your
Phyllis.
time.
Thank you for your work. Okay, Walter, you're up next.
Good afternoon.
Good afternoon.
I have a different opinion about some of the things the sheriff has said. I've read a lot of books about this minimum mandatory stuff, and I think judges are a little more intelligent than a lot of people give them credit for. I mean, they have the access to probation officers and different people in the system. Why put somebody in jail for 5-10 years for some kind of minor crime, like a couple ounces of marijuana or something? It costs the taxpayers $45,000 a year to keep them in jail. The people who want these minimum mandatory sentences are the people who build jails, private contractors to build jails, so they can pay high salaries for chief executive officers. I think that there's enough trained people in the criminal justice system, and that judges should have discretion to not go to the minimum sentences. They should be able to, especially if a person has some family support or something like that, they should be able to attempt to try to be rehabilitated. I also don't agree with the idea that marijuana is no good. I've seen a couple of programs on CNN television. Medical marijuana is good for lots of people. They had a young girl on the television who was about 6 years old, which I never thought that marijuana could ever be given to a 6-year-old. But a doctor did provide. This girl had seizures ever since the time she was born. They showed pictures of her wiggling around all the time. She had these, and they had a counter of prescription drugs that was bigger than my arms that they tried on it. They spent thousands of dollars on prescription drugs. None of it worked. Medical marijuana worked, and the child is now able to function and able to move around and actually go back to school. So I think it's worth testing. Well, it's going to be on the ballot, I think, on the 14th to vote on it. I still think we ought to do more about the Florida retirement system. I don't think we're doing enough. I think there's a couple of simple solutions can be done. You could take the ratio of retirement for particularly police and fire people who get a ratio of 3 for retirement, reduce that to 2. I mean, if somebody has a ratio of 3 and they worked 33 years, they get 100% of their salary for retirement for life. I think that's absurd. Thank you.
Thank you, Walter. Okay, you are up, Fred.
Thank you, Mrs. Mayfield,
You're
Mr. Altman, Mr. Negrin. 3 real quick things. One, I became aware that Indian River County has failed to notify its insurance carriers over a couple of lawsuits that are filed against the county, which would be costly. As a result of that, I would like you to institute whatever it takes, legislation or direction from the Department of Insurance, that any, whether it's small claims county, circuit, or federal court served upon the county, must be forwarded to their insurance carrier within 72 hours, and that the insurance carrier shall be duty-bound to notify the plaintiff that they have received a notice from the county and who their contact person is. They are the ones at risk on that issue. Secondly, a law that when the county decides to take property by resolution, that they will be for a road, that they will be required to within 1 year initiate the upgrading of this property to the highest standards of road in that area. Thirdly, Florida needs to revise, bring up to date in modern times or something, restoring civil rights. I don't know if anybody spoke to you, Mrs. Mayfield, directly from Monroe County, but I have a friend down there who has a civil rights issue, and your colleague, I can't think of her name at the moment.
Representative Rashanen, I think is
something like, you pronounce it.
Yeah, she's a great lady.
Yeah, she is working on this, but, person who, in order to make a living, and the crime did not involve boats or airplanes, period. No civil rights, can't get a license to operate a boat, can't fly. What is someone like that to do? Resort to crime, in order to survive? I mean, if the prison system is to, help and upgrade, you have to, when it's over, it's over. I mean, punishment is not supposed to go on for life. And apparently we have a governor who's decided it should. And I'd ask the legislature to take a look at that in general. I mean, I agree that if someone used a gun in a crime, civil rights should restrict, you're not going to be allowed to have anything to do with firearms. But there has to be a way that these people can get back to careers that they had, particularly when it's first-time offenders. Second and third time, that's one that I'm not going to comment on. And I wish to thank you for your duty to the public. I think all of you do a great job, and carry on.
Thank you. Let's go back to the county road. But I want to make sure that now that you're talking about the county road, when they take the property back, they take a private road, it becomes a county road. You want them to maintain it to the highest standard.
To the highest standards when they take it.
Have you spoke to the county, because that really is a county issue? The states can't tell the county how to operate their business.
The state can tell the county, if you're going to take property, you will. If you claim you need it for a road, you need it now.
Right.
Do it. And this is a case of taking without paying for it.
Okay. But have you spoke to the county about the specific issues you have on those roads? Okay.
There's a case, two cases in court involving it, and there may be a $20 million federal case filed before the end of the year against the county because of it.
Okay, great. Thank you. Thank you,
You're
Walter.
welcome.
Okay, that ends all of our participation in it. Okay. One, I want to thank everybody that stuck out for this. I mean, this is nice that you guys that you stayed to the end, which is wonderful. The chamber is having a luncheon. I don't know if you've all RSVP'd or not, but it is at 12:30 at the old county courthouse. And I just want to again thank you guys. This is what this is about. I know we went over, but I think it's very important that people have a chance to talk. This is the one time of the year that we can all get together as a group and do it. So thank you very much for coming, and we have the meeting adjourned.